Radical prostatectomy and urinary control. It's probably a subject you're not going to find too many videos on, or information for that matter. But guess what? Whether you're going through prostate surgery or radiation, you're going to have problems regaining urinary and bladder control. And that's just the way it is. I've gone to a number of support groups, and I can tell you that's one of the main issues, is how quick, or if you ever do recover there. Now, personally, right after surgery, I had to use a number of pads per day, and it was depressing, to say the least. But all of a sudden, after about 3 months, I had a terrific recovery, not total, but pretty good, and I don't know exactly what to attribute to that, but since then, naturally I'd like to get back to 100%, and I'm working on that. One of the ways that I'm working on that, I just started, is seeing a specialist, and we're doing some biofeedback, and this is going to show you a typical biofeedback session. And what you're trying to do here is build up your pelvic muscles and try and regain control so you can totally eliminate any possible leakage.
Muscle resting tone. And then in about 15 seconds, we're going to start doing the quick flicks, which are 2-second holds and 4-second relaxation times. After that, we'll do the 10-second holds. So at this point in time, your resting tone is about 1.6. You're between 1 and 2, which is considered very normal. So this is with normal breathing, no movement. And now we're going to start the quick flicks. You're going to squeeze for 2 seconds, and then you're going to drop it as quickly as you possibly can, down to 0 or down to 2 microvolts, squeezing again, dropping. So we call that the work-rest ratio. In 1 second, squeeze again, and then drop it. Release for 4 seconds. Ready, and squeeze 1, 1,000, 2, 1,000, rest. Good drops. Go ahead and squeeze firmly, making sure you breathe and release. And we want to make sure you're releasing completely. Here's another squeeze. Dropping completely, making sure your buttocks are not contributing at all. Ready, and squeeze again. Drop it completely down. Good. Relax for 2. Ready, and squeeze. And drop it. We have 2 more. Ready, and squeeze. And release it completely. Breathe normally. And 1 more squeeze. And drop it. And now we're going to do the 10-second holds. We're going to do 4 of them. So what I'm going to have you do is go ahead and squeeze and hold and breathe. And hold and breathe for 6 more seconds. Squeezing and holding. Squeezing and holding. Squeezing and holding. And now release it completely. And then just don't move too much. You just happen to be moving your leg a little bit, and that just shows a little more register, we call it. A little artifact on the EMG readout. We always have you relax twice as long as we have you contract, just to allow the muscles to fully recover and get good blood flow to the tissue. And in 3 seconds, you're going to squeeze again. Ready? And squeeze hard. Squeeze and hold and breathe. Release the gluteals. Squeeze and hold and breathe. Doing great. 3 more seconds. Squeeze and hold and breathe, and release. And you want it to look as much like a tabletop as possible. Now, the only reason you're not releasing there is because your leg moved, so I made a note of that. So you're going to release for about 10 more seconds, and we'll do 2 more. Your relaxation is still only in the 2 microvolt, and that's still considered very normal. So in about 3 seconds, we're going to squeeze again. Ready? And squeeze hard. Squeeze and hold, breathing. Squeeze and hold, breathing. No movement. Squeeze and hold, breathing. 2 more seconds. Now release it completely and just let your muscles recover as fast a drop as possible. And once again, I think there was just a little movement there, so the drop wasn't as it was a good drop, but your body movement just impaired the readout just a little bit. A little movement again. Sometimes talk, coughing, all that stuff can get a readout for an EMG. 2 more seconds. We're going to squeeze one more time. Go ahead and squeeze, pull in, breathing, squeezing, breathing, squeezing. No gluteals, no leg movement. Breathing as normal as you possibly can. 2 more seconds, and then drop and relax for 20 seconds. And just let the whole muscles recover. That was an excellent drop if you see the release. And yeah, your resting tone is still about 2.0, 2.3, and that's considered within normal limits.
Okay, I think we got it.
This video series is an ongoing project. I try to add about a video per month on average. If you'd like to see all the videos in one place, the title of each video in a chronological order, please visit our site. When you go there, just click through, and on the left side of the page you'll see a menu buttons listing a lot of medical research studies that are ongoing here in San Diego. Just scroll down until you see the prostate cancer button. Click that, and that'll take you through to another page. On the left side of that page you'll see other buttons for the 4 main types of prostate cancer surgery. The last button listed there on the left is for prostate cancer videos. Click that button. That'll take you through to the page where all our videos are listed. They're listed by menu buttons on the left side of the page, as well as a table right in the center of the page that has all the videos numbered and the title of each video. Thanks for watching.